This is the last sitting of the week before a major event happens in Addis Ababa. And I'm happy that Senator Olekina is back from Addis. He was there overnight to just ensure that everything is okay. He has assured me that everything is going well, and that after this sitting, he will also be leaving back for Addis to ensure that everything goes. I wish Baba well, and I wish the team that is there representing as well. The rest of us are here holding fort. Honorable Speaker, we have treated the people who work in our medical institutions with absolute contempt. I remember last year, in the last session, medical interns were seated here, and we as a House had made a promise to them that we were going to support them to ensure that not only are they absorbed into the workforce, but also that they are treated well and fairly and remunerated in accordance with their qualifications. I remember the big debate on whether interns were actually interns in the sense of the word that is used, as is used in other professions, or whether these were in fact qualified medical practitioners, Honorable Speaker, and full doctors who were being mistreated. I remember there was a long period where there was a doctor strike. Dr. Halwale remembers that period, and we thought that all these matters have been resolved. Honorable Speaker, we speak to some of these interns, and some of them who were lucky to get employment in places like this gentleman in Thika Level 5, others in Nakuru, even here in Nairobi. Honorable Speaker, some of them, after being out of employment for so long, after being promised good working conditions, even those counties are not paying them salaries. Some of them have arrears of up to 3-6 months, Honorable Speaker. So as a House and the Health Committee that has just been reconstituted, we really need to be serious about our medical health practitioners. Yesterday, Honorable Speaker, we were talking about the way the community health promoters are being treated. I had occasion, together with my delegation from Nairobi of senators, Honorable Speaker, to have a meeting with a section of the county health promoters in Nairobi, the community health promoters in Nairobi. And Honorable Speaker, the horror stories that we had from that group requires that we as a House do something. Honorable Speaker, you can imagine people going to work without basic protective equipment. Here in Nairobi, Honorable Speaker, when it rains, and most of these community health promoters are working as frontline workers in places such as our slum areas, Honorable Speaker. When it rains, you cannot go in there without proper shoes or gumboots. Honorable Speaker, can you imagine the community health promoters in Nairobi, numbering over 7,000, asking a senator like myself to buy them gumboots because the county government is unable to supply them with these gumboots? When I speak to the management at Bata, Honorable Halwale, one pair of gumboots is going at 700 shillings, Honorable Speaker. Everybody knows my salary, and you know what the taxman has done to our pay slips, Honorable Speaker. How can a senator be expected to spend 5 million shillings on buying gumboots for community health promoters, and yet we resource our county governments properly for them to be able to equip our community health promoters to work for us? Honorable Speaker, when we talk about the deteriorating levels of health services in the counties and the statement that was brought by FACI, we also need to look at the financing element for our hospitals. I was speaking to the CEO of Mbagathi Hospital today, Honorable Speaker, to just find out the status of the repayment by SHA. And this was prompted because when I looked at my pay slip again, I am being deducted 32,000 Kenya shillings every day, and we were told that this is going to be the panacea of all our problems in the health sector. The CEO at Mbagathi tells me that they are billing SHA shillings 4 million per day. And if you do the math, it is over 120 million shillings per month that SHA is supposed to pay Mbagathi Hospital. But SHA is paying Mbagathi Hospital a measly 15 million shillings per month. How are they supposed to provide services, Honorable Speaker? As we speak today, the social health assurance owes Mbagathi Hospital alone 400 million Kenya shillings. And then we expect these hospitals to serve the people of Nairobi. Therefore, Honorable Speaker, we must raise these issues, and we want the committee that has been charged with these two statements to ensure that they come to the bottom of all these issues so that we are able to not only treat our community health promoters and the medical interns and everybody who works in the health sector with dignity, but also are able to unlock the problem of financing from SHA. Lastly, Honorable Speaker, at the invitation of the Senator of Mandera, me and some colleagues, and I can see has walked in, visited the health facilities in Mandera. And one of the things is that many of the equipment that had been procured under the medical leasing scheme those contracts are coming to an end. And the information we gathered from Mandera is that the suppliers of the new equipment are putting very onerous terms in terms of percentages of the money that is supposed to be paid to those suppliers on these county governments. They told us it is as high as 60% of the payment that is paid for that service is required to go back to the medical supplier, the equipment supplier. So as a Senate, we must bring those contracts into focus here, and I want to urge the Health Committee to ensure that this is done so that our people can enjoy proper health facilities. I thank you, Honorable Speaker.
Senator Samson Cherargei.
Mr. Speaker, I want to, from the onset, to thank you for giving me this opportunity. I want to support the statement by Senator Mohammed Faki, Senator 001 from Mombasa, for this wonderful statement. Mr. Speaker, sir, I agree. I thought Mombasa is better. In terms of poor service delivery of health services, Nandi should be #1 in poor service delivery. Mr. Speaker, because in 1st December 2024, I did visit Kapsabet County Referral Hospital, which should be our referral facility. Mr. Speaker, I remember you calling me that you saw the pictures and you saw the pathetic and dilapidated situation at Kapsabet County Referral Hospital. Mr. Speaker, some of us who have worked this journey of devolution, we have always thought that can we form National Health Commission? Because the crisis that you see in Mombasa, in Nairobi, in Nandi, among other constituencies, Mr. Speaker, among other counties, is saddening. Even I remember you lost a child at, is it Kaplong or is it Tenwek? Yeah, because of negligence in Bomet Hospital, that a young child, because of negligence. Mr. Speaker.
Senator Cherargei, that was in Longisa Hospital, and the second one was in Cheptala.